Welcome back. Dr. Suzanne Manzi with Performance Pain and Sports Medicine in Houston, Texas. I welcome you back to Pain Diaries on Now Media Television. As you know from watching previous episodes, medical technology is one of my passions, and innovative devices allow us at Performance Pain and Sports Medicine and other doctors across the entire country to change people's lives. Today, we're going to feature ReActiv8, Mainstay Medical's featured device, which is a cure for chronic low back pain. The amazing thing about this device is it does not just mask the pain, but it aims to alleviate the pain at its root cause. We're talking about chronic low back pain. We're going to talk on how this device can restore your function and reactivate your muscles of your low back. First of all, let's step back. Two different types of refractory chronic low back pain require a different approach. So first of all, what is low back pain? There's two different types. The first type we'll talk about is radicular pain. Ridiculous? No. Radicular is Latin for root, the nerve root. Radicular pain is pain that travels down your legs and can be due to failed back surgery or the reason you needed back surgery in the first place. The nerve root is affected. The nerve can be pinched or be caused by stenosis, which is narrowing of the canal where the nerve comes out of your spinal canal. Now, what are usually the treatments for this? We use medications, surgery, or palliative therapy, such as spinal cord stimulation or an intrathecal pain pump therapy. Now, palliative therapy means it doesn't actually fix the problem, it just masks the pain. And a third of chronic low back pain patients have this, quote, radicular type pain. Sometimes you hear it referred to as sciatica, or just that pain that travels from your low back all the way down your leg. It's very frustrating to have this type of nerve type pain. The second type of chronic low back pain is a mechanical or nociceptive chronic low back pain. Initially, you have an injury, a very small injury to the low back. This could be just a tweak, when you least expect it. What if you bend over and pick your sock up off the floor, and then, oh my goodness, you can't move for 3 days? This might happen once a year, but then it becomes more frequent, and the cycle becomes a cycle, and it happens over and over again with less frequency in between, and it becomes a nuance. This results in a cycle of neuromuscular inhibition. That's your brain signaling your muscles. This neuromuscular inhibition of your stabilizing muscles of the low back can cause the problem. These muscles are called multifidi, or the multifidus muscles. This usually leads to functional spine joint instability, overload, and then pain. So currently, treatment options focus on covering the pain, or are, quote, palliative, whether they be medications, injections, radiofrequency ablation, all things we've talked about on this show that us as pain doctors utilize to help people get better and help their pain levels reduce so they can become functional again. 2/3 of patients with chronic low back pain suffer from this mechanical type pain. So the million-dollar question is, how do we break that cycle? If the problem's due to an injury, again, this is a simple injury. We could then develop arthritis or degeneration of our vertebrae, where your vertebral bodies can even slip in front of each other, called spondylolisthesis. It's a big word. But again, it's just a dysfunction of the way your bones are aligned in your spine. Injections that we utilize include medial branch blocks, which are little numbing injections that go over the nerves that go to your joints, facet injections, which are the actual joints of your low back, and radiofrequency ablation, where we actually take heat and cauterize those nerves that go to the joint so your brain doesn't feel the pain coming from the joints anymore. These type of treatments are geared toward covering up the pain and mask the pain. But 2/3 of patients with chronic low back pain are thought to have this type of pain specifically. So after this type of injury, the spine becomes overloaded, and this leads to spine, joint, and tissue pain. What happens then? Our bodies then reflexively respond with multifidi inhibition. Our body wants to respond, but it can't. Our bodies then prevent these muscles from firing, as we're afraid there's going to be more pain. Our brain signals our spine not to fire those muscles because we don't want to feel the pain. And it's all at a subconscious level, where your body adapts and makes these decisions at the level of your brain and your muscle connection. This leads to functional spine and joint instability, and then this leads to more spine and joint overload, which then tells your brain you have pain. Then more multifidus muscle inhibition happens, and the cycle just keeps repeating itself. And this is why people you know that have a low back pain can potentially have more low back pain more frequently with smaller and smaller little injuries. This is the problem, and no one's addressed it in the past. The multifidus muscle is important. The goal is to restore and fix the pain. This is the primary stabilizer of your lumbar spine. This contracts involuntarily. It does this on its own to maintain the stability in the low back. Think of a skeleton for Halloween. When you stand up that skeleton, it just collapses. We don't collapse because we have our muscles stabilizing us. And what keeps our spine upright and erect are our multifidi muscles in our low back. So when there's pain, our bodies reflexively inhibit the muscles from firing. If you don't use it, you lose it, which is the same in the multifidus muscle as well. Sometimes when we don't use this muscle, small amounts of fat can deposit in the muscle over time. Think about your filet mignon versus your ribeye. When you have a filet mignon, you know it's a great cut of steak when there's not much fat in it. But with that ribeye, you want that marbling of the fat inside. Now, this is what happens to our muscle. When fat deposits into our muscle, it's because we're not using the muscle. And so our multifidi turn from a filet mignon type texture to a ribeye type texture. I hope you found this information informative. I'm going to play a little video right now so you can understand what the ReActiv8 device looks like and what it really is.
Mainstay's ReActiv8 is an implantable device designed to electrically stimulate nerves to activate key stabilizing muscles of the lumbar spine. Chronic low back pain consists of an ongoing cycle of muscle weakening, pain, and activation suppression of the core spine muscles by the brain. ReActiv8 is designed to stimulate the nerves responsible for contracting the multifidus muscles. The brain senses the muscle contractions, and in response can trigger restoration of muscle control. With the multifidus again providing joint stability, the continuing cycle is interrupted, facilitating a recovery from chronic low back pain.
The opportunities are endless in helping change people's lives who are suffering. And the ReActiv8 device is one of the modalities we utilize at Performance Pain and Sports Medicine in hopes of relieving suffering, improving function, and especially reactivating the muscles of the low back. Stay tuned for more to come. I'm Dr. Suzanne Manzi here on NowMediaTV in Houston, Texas. And this is Pain Diaries.